What does a chest X-ray show for COPD patients? Imagine looking at a picture of your lungs that tells a story about how well they are working. That's what a chest X-ray can do for someone with chronic obstructive pulmonary disease. When doctors look at these images, they are searching for specific signs that indicate how the lungs have changed because of the disease. The most common thing they see is called hyperinflated lungs. This means the lungs look larger than normal because air gets trapped inside them. You might notice the diaphragm, which is the muscle that helps you breathe, appears flattened or even concave instead of its usual dome shape. This flattening shows that the lungs are overexpanded. On a side view of the chest, the space behind the sternum, called the retrosternal space, looks bigger because the lungs are pushing outward. The heart may seem narrower and more vertical because the enlarged lungs press against it, changing its shape. Blood vessels in the lungs often look less prominent, a change known as vascular pruning, especially in areas affected by emphysema. Sometimes, large air pockets called bullae form in the upper parts of the lungs. These are areas where lung tissue has been destroyed and replaced with air. The spaces between the ribs can appear wider due to the lungs expanding outward. In cases of chronic bronchitis, the X-ray might show more prominent lung markings, which are the inflamed airways. The heart might seem to float above the diaphragm because of the lung overexpansion. While a chest X-ray can suggest COPD and show these characteristic signs, it is not perfect for catching early disease. It is mainly used to support diagnosis, see how severe the disease is, or rule out other problems like infections or lung cancer. Doctors find chest X-rays quick, simple, and widely available for checking lung health. But for a more detailed look at emphysema or early changes, they might order a CORT scan. In summary, a chest X-ray for COPD patients often shows lungs that are bigger than normal with flattened diaphragms, a narrower heart shape, less visible blood vessels, and sometimes large air pockets. These clues help doctors understand the extent of lung damage and guide treatment decisions.